If you've been told surgery is your only option for an L5-S1 disc herniation, stop right there, because there's a safer, research-backed way to fix this problem without going under the knife. I'm talking about two treatments that, when combined, deliver a 90% plus success rate for recovery. They're not painkillers, they're not injections, and they've helped thousands of people avoid back surgery altogether. In this video, I'm going to show you exactly what these two treatments are, how they work together, and why they can give you real relief fast. Imagine this: less leg pain, better mobility, and the ability to sit, stand, and walk without that constant pressure. And in some cases, within weeks of starting this combination. Stay with me until the end, because I'll show you how to apply these treatments in the right way so you give yourself the best chance of avoiding surgery and getting back to living your life. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. I upload a new video every week. A big reason why many treatments for L5-S1 disc herniation don't work is because the root causes are never actually addressed. In a lot of cases, exercises are given too soon and before the spine is stable enough, or before the inflammation has calmed down. Pain medications, anti-inflammatories, even epidural injections might help temporarily, but they often wear off fast and don't make much of a difference at all, and they have their side effects. Here's the key: you have to target the underlying cause, and for most patients, that's right, most, it's multiple causes of the herniation, not just the pain. And at the same time, you need to reduce the inflammation and pressure on the disc itself so it can begin to heal. In our clinic, we do this simultaneously, and it's what makes us unique and different. And that's exactly what I'm going to walk you through next. You might think lasers are just for skin treatments or healing sprained ankles or something you're going to see in the James Bond movie, but Class 4 laser therapy is on a completely different level when it comes to disc injuries. This isn't surface level pain relief. Class 4 laser therapy uses concentrated light energy to penetrate deep into the spine, stimulate tissue repair, and calm down inflammation right at the source of the problem. So how does it actually help with an L5-S1 disc herniation? First, it's going to reduce the inflammation around the disc and the surrounding nerves, which is one of the main causes of leg pain and sciatica symptoms. Second, it accelerates healing by increasing cellular energy. That's what we call ATP production, and it helps the injured disc and surrounding tissues repair more efficiently. And third, it improves blood flow to the area, which means more oxygen, more nutrients, and faster tissue recovery, all without the need for drugs or downtime. And the best part, most people start to notice a difference in pain, swelling, and mobility within just a few sessions. But laser therapy alone isn't enough, because if you don't relieve the actual pressure on the disc itself, the healing process can stall. That's where the non-surgical spinal decompression comes in, and where you combine them, the results can be powerful. If your L5-S1 disc is herniated, then you already know what compression feels like: nerve pressure, shooting pain, tightness, and that constant feeling like your spine is stuck. That's exactly why spinal decompression works. It's one of the only treatments that directly addresses the root problem of too much pressure on the disc. This is not traction, this is not inversion, this is spinal decompression. Here's how it works. Spinal decompression gently decompresses the spine using a computer-guided system that targets the injured disc. This controlled decompression creates negative pressure inside the disc, almost like a vacuum effect, which helps pull bulging or herniated material back towards the center. This again is what makes it so different than traction or inversion. Traction is more of a stretching. Can that be beneficial? Sure. Will that ever cause true decompression? Absolutely not. It cannot cause negative pressure within the disc. Spinal decompression creates that negative pressure. So at the same time, spinal decompression increases the space between the vertebrae, relieving pressure on the spinal nerves, especially the ones that cause leg pain and sciatica. So how does this benefit an L5-S1 disc herniation? Well, first, it relieves nerve compression almost immediately, which can reduce or eliminate shooting leg pain. Second, it rehydrates the disc by drawing water and nutrients back in. This is key for reversing disc desiccation and restoring disc height. Third, it creates long-term change by improving spinal mobility and reducing load on the herniated discs with every session. This isn't just symptom relief, it's correction of the mechanical problem. And when you combine this with Class 4 laser therapy, the results are even more powerful. You're not just removing pressure, you're accelerating healing. So let me explain how the combination works and why it gives people a 90% plus success rate in recovery. We're inside my non-surgical robotic laser spinal decompression room right now. So again, this may be hard for you to see, but there are different robotic patterns, the different laser intensities. Just at a range is the amount of spinal decompression, the amount of tension, the time intervals, and so forth. The opening that you see right here, or hard for you to see, but the opening comes right from underneath the system while the spinal decompression actually happens. That's the beauty of it all. It all happens at the same time. So then imagine getting the benefits of class 4 robotic laser therapy at the exact same time that your spine is being gently decompressed by a computer-guided system. That's exactly what makes non-surgical robotic laser spinal decompression so unique. There's only 12 of these in the world. This isn't just two treatments done back to back. It's a synchronized dual action system where the class 4 robotic deep tissue laser and spinal decompression system work together in real time. It targets the injured disc with unmatched precision and effectiveness. As I said, only 12 clinics in the entire world with this specialized robotic system, and we're proud to be the only one right here in Ottawa, Ontario. And the results, they speak for themselves. We see over a 90% plus success rate with our disc bulges and disc herniation patients. Many begin to experience less leg pain, better mobility, and improved posture within just a few weeks of starting care. Others go on to make a full recovery within 3 months, no surgery, no pain medications, and no longer living in fear of flare-ups. Non-surgical robotic laser spinal decompression is truly a breakthrough. It's not just pain relief, it's a new way forward for people who feel stuck, hopeless, or told they have no other option. Everyone suffering from an L5-S1 or even an L4, L5 disc herniation deserves to know this is possible and to try everything before considering surgery. If you're looking for a clinic that offers non-surgical robotic laser spinal decompression, please leave a comment below and I'll do my best to guide you. As I said, there's only 12 in the world. And if you're in the Ottawa area or willing to travel, like many of our patients do, reach out to us directly. We've helped thousands of patients overcome disc injuries, reclaim their mobility, and avoid surgery altogether. There is hope, and this may be the solution you've been waiting for. And don't forget to subscribe if you're looking for more proven tips and strategies to treat and relieve debilitating back and neck pain without relying on drugs or surgery. Now, taking the right supplements during your disc herniation treatment and recovery can help speed up healing and support long-term disc health. If you want to see my top 5 recommended supplements based on the best scientific research that I give to my patients, go watch this video next. 5 best supplements to heal L4-5 disc pain and sciatica fast.